So what WHO says is almost every year around 5.4 million people are bitten by snakes. And out of these, almost 80,000 to around 1.37 lakh people die of snake bite. Above this, almost 4 lakh or more than 4 lakh people have a morbidity which leads to paralysis or amputation due to snake bites. So it's the topic. Actually, if we see, the burden is huge globally. What is the scenario in India? Now India, as per the estimate, what it says is 3 to 4 million cases and more than 50,000 deaths due to snake bites. But what is reported right now is very, very low. If we see CBHI data, it says around 2,000 deaths only of snake bites. But then estimated is around more than 50,000. So we know very less about snake bites when actually if we see, remove our papers and data and see, we know very, very less about snake bites, what is happening in India or globally. So keeping this in mind, even at WHO level, there is a goal which is fixed till 2030 to decrease deaths due to snake bite by 50%. And taking this goal forward in India at national level, there is a program which is started last year, a national program on control and prevention of snake bite and envenomation. Now, despite of all these numbers, snake bite is still called as neglected tropical disease. Who is worried about snake bite right now is the person who gets bitten and the person who is treating them at various locations, whether maybe it is PSC, district hospital, GMC, or even in a private clinics. When it comes to GMC and district hospital, doctors are little more relaxed because there is a care which is available, there is an expertise which is available. What happens at PSC level? So at PSC level, there are lots and lots of doubts. The doubt starts right from what is a snake, identification of snake, whether it is a poisonous, non-poisonous. What do I do now next? My PSC is much far from district hospital or GMC. Do I refer him directly? Okay. Whether I can keep him in my PSC for observation or not. So all these doubts, even if after I test, when do I give him ASV? How much do I give him as ASV? If I give him ASV, again he will have a complication due to anaphylaxis or not. ASV as such is available even till the last PSC. But then the confidence will come only when we will know more about the management, more about what is happening currently, more about the knowledge of when to give, how to give, all these queries. Okay. So all these doubts from our medical field especially needs to be removed, and that is why this CME is being called today. So that as a homeopathic physician, you take this back message to your other colleagues, to the communities, the first hand knowledge about the snake bites, and then comes to the management. Now, this program which is started, National Program on Prevention and Control of Snake Bite, has three major objectives. One is about training all our health staff. That means right from doctors, nurses, paramedics, everybody. Second is about ensuring availability of the anti-snake venom till the last point where patients are coming to us. And then thirdly, to educate our communities and general public. If we need to do all these three things together, what is needed is to we as a healthcare workers to be aware about snake bites properly. We should not have doubts in that. If you remember about rabies program, if we go back 10 to 12 years back, when rabies program was not full-fledged launched at national level, we were giving rabies treatment for ages, right? For decades we are giving treatment. But then there were doubts. But if you see now, present day, the rabies vaccine as well as immunoglobulin is available at all PSC level till GMC. There are very, very few doubts. Now we have done so many programs or talks on rabies that all these doubts have come out from the people whom we have spoken to, and then we have got answers to those doubts. Now something like this needs to be done for year to come with respect to snake bite. So let's take these opportunities, let's hear from the experts today, and then have doubts, whatever doubts are there in our minds, let's clarify those.
We know about this many 500 people, like I was just talking to Dr. Utkarsh, around 500 people are having a snake bite every year. 500 is a big number. Why 500? To have a single death because of any accident, we take it very seriously. It is not that we take it very lightly. I don't know, when I was in GMC, when it is still then, we used to have a monthly meeting, and even one death, which is reported, not because of a routine thing, some medical negligence, it has to be taken for a discussion, and everything was discussed. Actions were taken, find out why it is there. So one death for a doctor is also very important. For a simple reason I am telling you, in your practice, if one wrong thing happens in your full career, it is enough to have it. You must have heard, you must have read in papers. So one that also you have to take it very seriously as a doctor. First of all, let me congratulate the Homeopathic, Association for having CMEs. CMEs are always important. As a doctor, we all have one thing in common. What is that? Interest of patient, interest of society, interest of public. So that is which is common to us. And I'm sure after attending these CMEs, you all must be good in your subject. All must be having the excellent knowledge of snake bite, type of snake bite, poisonous, non-poisonous, different type of snake. What is the emergency treatment? What is the preventive measures we can take? Where to refer? Everybody. But I'm sure you all, both the experts today will have that. Definitely will enlighten you. You must have so many doubts. They will clear your doubts. So after finishing this way, when you will be leaving this hall, definitely any doctor who attends CME takes some extra points and rules. So that is the importance of CME. So my request, not now and henceforth also for all of you all, whenever any CME is there, please do attend. For doctors or for anybody, age is not a limit. Even if tomorrow I become 70 and if I attend some CME, there is a lot to learn. Every day there are new things evolve. All you all must be thinking, after joining politics, I have forgot my ophthalmology. Absolutely not. Today also I operate. I don't know how many you all know. And I do maximum practice. In fact, after joining, my practice has increased more. Every day I do around 15 to 20 operations. I don't know. So I don't leave my hospital in the morning hour. Never. It is 8 to 3. I am always in the hospital. I work from the hospital. I take my whatever it is, my constituency, political staff in the office they manage it. You should know to manage. So what I mean to say, never miss a CME. See what has happened so many times, we attend CME only because for those credit points. I don't know, but our association, we require to have 30 credit points for 5 years to renew our license for allopathy. I don't know about your homeopathy also, there is a credit point with that.
It is gone for the implementation.
It is gone for the implementation. But don't attend for credit point. See one thing, this profession is such, believe me, take this message correctly from me. You do it from heart, you will never have a deficiency of patience. Mark my word. Manatlan kara, itle kara ki that patient, when it comes in your cabin, the patient should feel, this doctor is for me only. He doesn't have anything in mind. This doctor has forgotten about his family, about his surrounding. Doctor and patient, that's all relation. And the doctor should feel, the patient should feel, this doctor will do each and everything for their patient. You know what, I had a doubt after joining politics, and so many people advise also, my seniors, why do you want to join this politics and all, you are having such a good practice, one of the best practice, means I can boast now also, then also, I got #1 practice ophthalmology. I don't know whether you all know, my number surgical is so high, even if I just operate, it's enough for me. That's what I'm doing. So I had a worry that now patient will not come. They'll say doctor has become MLA. I had a worry. But believe me, whenever I go to hospital, I go Monday to Friday. My timings are only Wednesday evening. Today evening I'll be doing OPD. Otherwise 8 to 3. Whenever I'm there in hospital, whether it is a holiday or whatever, my OPD is always full. Appointment you will not get 1 month back. But that doesn't mean, though my appointment is 1 month back, but if somebody calls me in the morning or the hospital emergency, I never say no to patient. At this period also, even on Sunday some emergencies there, my other consultant, I got some 7-8 consultants, 8 ophthalmologists I got. I still attend an emergency call. And you know how much I take for that emergency call? If I come to hospital to remove foreign body, usually emergency are foreign body, it's really. I hardly charge 500 to 700, my consultation. But question of that money is not important. See, that patient always remember that night on that Sunday only Dr. Shetty came and solved my problem. That patient becomes mine forever. So what I mean to say, if you work now, see as a doctor, I mean some of you all in government service, they will get pension. Otherwise who are working in private, we don't have pension, no salary, nothing. What our pension or this is the faith, is the goodwill which you build with these patients. So my worry was that I won't have patient, but what I have worked last 22 years, all that is retaining now, they come in that faith. So my request to all of you all, upgrade your knowledge. Any subject it might be. Most of you all think, a snake bite when I will get once a year one patient. But that one patient can change your life. As I said, one patient, bad patient can damage you. One patient, that will give a bad, good. And one thing you believe, whatever profession you take, you have to live with this profession. You have to live as a doctor, you have to die as a doctor. So why not to have the best knowledge in this subject? What is wrong in having the best knowledge? And best correct knowledge, only an expert can give you, a book can give you. You know, to give a talk on any subject, how much trouble that speaker has to take. You all of you all must have last night good dinner, nice sleep and come. Poor speakers, they know they wanted to speak with the doctors. So they were like, doing all the latest studies. Because one of you all get up and ask, tell me what is the statistics last year? How many types of poisonous snakes are there? You can ask any question, no? Huh? What types of is there any new studies have been done? New thesis has been done, new antivenomous this thing has come. You can ask anything. So poor, what are these? So that's why whenever you all go for CME, whenever you all goes for CME, please attend. It is not that easy, madam, to talk on any topic. You need to really academically give the latest knowledge. So that's why I am very smart. I am not speaking anything on snake bite. Basically, I would love to speak. Frankly speaking, when I was coming, I told my other colleague, I want to know about anti-snake. So I got all the data. I know all these people experts are there. No, I can tell you, and that way, I love to read my books. But on this chair, my only thing is that all of our work should help the society. Society should be our point focus. Anybody who get help because of my knowledge, you should feel, and always, in this profession, whenever I don't know about my style of working, you all must be, all of you all are good on Facebook, Insta and all. I am hardly on that. If politically I am there, then my political team is doing. Personally, I am hardly on Facebook, Insta, and hardly. Because I don't handle also my thing. And before joining politics, I never had Facebook and all like that. So what I want to say, you do such a good work that let your work speak. I know all this Facebook, Insta, marketing, all that is a part and parcel. I am not against that. But work stand the best. And at least in Goa, I don't know. Goa, if you see, I will openly make this statement. Which doctors are doing good? Goa, if you see, all nursing home and hospital are doing, but corporates are not that doing well. In fact, whichever corporates are closed, except for Manipal. But it took 4 decades to come to this level. Whereas other hospital, all whoever individual hospital, they are doing excellent. Why? Because in Goa, it's a small. Goa is a different state altogether. We have got 15 lakh population. Each one knows everyone. Even if I stand here and tell something, you know everything. Many of you all know, you all have been my patient. Everything else. I need not tell who am I, what I am doing it. So Goa, how people approach a doctor is mostly by their name, their expertise, their knowledge, what is the treatment. So Goa is a bit different scenario.